So there are a variety of factors that historically haven't been that well incorporated within some of these value assessment frameworks. For one, the value to the family, the value to the caregiver, the value to friends and other relatives, basically everybody around the patient. Historically, value assessment frameworks have really concentrated on the value specifically to the patient, and again, the clinical value specifically to the patient, or perhaps the value to the payer, the entity that's actually paying for the therapy, perhaps not the patient themselves. But what the HTA bodies oftentimes don't incorporate is the value to the caregiver, that they can better actually deliver care to that patient, or the value to the family. Perhaps the mother or father is able to better sleep through the night because their child's able to better sleep through the night. And these are always incredibly important values that need to be taken into context. Another thing that HTA bodies oftentimes have some difficulty doing is incorporating the value to patients that is not particularly well understood. It's not the clinical value, but it's the quality of life value. It's the ability to go on a walk with a loved one. It's the ability to play on the softball team at work. It's all of these additional, perhaps less clinical benefits that also perhaps don't necessarily return cost savings to the insurer, but are still incredibly important for the patient and the value that these therapies can bring to the patient. And then one final thing that we're still hoping the HTA bodies are going to improve on, and they are actually improving on this right now, is better weighting the different values that therapies bring to the patients, even clinically speaking. For example, within hemophilia, oftentimes HTA bodies may look at the number of external bleeds as one of the main endpoints, one of the main indicators for the value of a therapy, when in actuality what we hear from the patients is joint bleeds, internal bleeds, and the effects that hemophilia has on joints actually is perhaps the most important endpoint, at least one of the most important endpoints. And so as HTA bodies are considering the value of these therapies, it's important that they hear from the patients so they understand what specific symptoms are most important to address, what specific endpoints are most valuable to patients, and therefore they can then quantify that value from the patient's point of view.